Well, community health is very important, as the recent pandemic of the COVID-19 has shown us and the whole world that if you're not prepared to have adequate health care and an ongoing system of access, many people in low and underserved communities will be at a major disadvantage in terms of access to health care and their physical well-being. All of our community members should have access to health care and opportunities to be as healthy as possible, within their communities and in the places that they reside.
We actually live through epidemics that people don't realize. One is a health epidemic. One is a mental health epidemic, a food epidemic. So these are things that communities like ours go through for decades.
How do you make an under-resourced community or help an under-resourced community move past being so-called under-resourced? My hope would be that more medical officers would institutionalize the social determinants measures and having a person in that office dedicated to getting their patients squared away in that regard. To me, that would be effective health care. Be it by a community health worker or a medical assistant, but that should be a quantifiable service provided.
After working at Ryan, I see how community health is really just having the freedom to take care of your health. It's really important to give people the freedom to access healthcare by, one, making the other burdens of their life easier by addressing social determinants of health, bringing vaccines to where people congregate, where people feel that they have a system of trust.
I think communities need access to the resources, the environment, and space that will allow them to not just survive, but also thrive and be able to be proactive about taking care of their health. So that means access to preventative healthcare services, so not just, triaging situations when you're in dire need, but having access to healthcare that allows you to actually take care of your health in a more proactive way.
You need to create a relationship with a doctor, a PCP, or at least a clinic that knows you and can help you. That part of emergency management and planning is resiliency, it's mitigation, it's making sure you're healthy, physically and mentally. All of these things are part of your recovery. It's hard to do one, it's almost impossible to do one without the other. When you're not prepared in one area, it's going to affect your mental health. It all goes together. You need to check your mental health, you need to check your physical health, the food, it's all essential in order to live a well-rounded life.